Well, welcome back to Walk with the Doc. This is November 2019. Glad you all could make it. Nice midday break. Probably all been glued to the television this morning and then take a little break and go back to the TV this afternoon or whatever you're doing today, right? Dr. Kevin Fillmore is one of the radiologists at Doylestown Health. Many of you have the impression, I suspect, like many people tell me, a radiologist is the person who sits in the dark room in the back and looks at all your x-rays and all your CAT scans. Well, they do much more than that, and he'll tell us about that today, and many of them actually meet with patients and do procedures. So, Dr. Kevin Fillmore.
Well, thanks everybody for having me out, and thanks Jim for the introduction. I guess everyone should be taking notes, given Dr. Kometsa's quiz coming up. That sounds intense, but I'll tell you a little bit about myself. So I'm a radiologist here at Doylestown. I've been working here for 11 years. I grew up in Erie, Pennsylvania, in the very northwest corner of the state. So this is like a warm summer day in Erie. So not cold there. And then I started to travel a little bit east. I went to Penn State for undergrad.
We are.
Penn State, we are. Yep. And then Temple for medical school in Philadelphia. And then I decided to go into radiology because I really liked anatomy and making diagnoses. So I matched at NYU in New York, and I did a 5-year residency there. And then after you do the residency in radiology, then most people go on and do a fellowship. There's a variety of fellowships you can do. I did mine in musculoskeletal radiology, study of joints and bones and stuff. So that's kind of my background. After I got done with NYU, my wife wanted to move back to the Philadelphia area, and Doylestown was looking for a radiologist, and voila, I'm in luck. I've been here ever since. What a wonderful place to work at Doylestown. I'm so lucky. No other hospital in the world really like Doylestown. Everyone here is so lucky to have Doylestown in their community. So my typical day, I am in a dark room for a lot of the time, kind of interpreting the x-rays. You might come in and get an x-ray exam, you'll meet the technologist, and they might take an x-ray of you or an MRI, and like, where's the radiologist at? Like, where is this guy? So we're in the back room, interpreting images. After you get your images done, they get sent electronically to our computer system, and then we display them up there. And then we use the history and the symptoms that are provided by your referring provider, and we look at the images and we come up with the best diagnosis we can, which hopefully isn't anything bad. Then once we arrive at a conclusion, we dictate it and create a report, and that report then gets sent to the doctor or nurse practitioner or physician's assistant that ordered the test. And we can contact them if it's like an emergent finding that something needs to be done for right away. But usually it's not emergent, and it's sad when we see like a bad diagnosis, but we sort of think that's our job to make the diagnosis, and we might be the first person to see it, like a cancer diagnosis, but we do our best to report that back then, and then you can get immediate care for that. We also do a lot of procedures where we're out of the dark room and we will meet patients where we use the images that we acquire to guide needles or catheters into different parts of the body to perform an intervention or a biopsy. So I'll talk about that a little bit. So I wanted to kind of discuss the different imaging things that we do in radiology. Has anyone here never had a chest x-ray? Because if so, they would be the healthiest person ever. Because everybody gets some type of imaging done. I've had a whole bunch myself. So there's a variety of different imaging studies done, and you might sometimes wonder, you go into your doctor and they're ordering different things. You're like, why this as opposed to that? So I'll discuss a little bit about the different modalities that we have. So the x-rays are our simplest test. You're usually standing there, lying down. X-ray tube is in front of you. Shoot an x-ray beam through you. There's a detector on the back, creates the image. Great way to diagnose pneumonia or congestive heart failure, two really common things. So the chest x-ray, that's our most common test we perform. Also a really good test for looking at the bones to see if there's a fracture, a broken bone, and to look for arthritis. X-ray is a quick and easy test, a very small amount of radiation, nothing to worry about. That's our easiest test there. Not too good for looking at soft tissues though. X-ray is not going to be able to tell you if you have a tendon tear or a ligament tear. Can't look inside the brain or anything like that. Can't look at the organs. So it does have its limitations. So fortunately we have some other things that we use for that. Another test we do is the ultrasound. There you come in, you're lying down, and someone's coming in with a transducer with some warm gel, hopefully, and putting it on you, kind of scanning. Anyone that's been pregnant, you've had that done a lot. Ultrasound, no radiation in ultrasound, so that's good. No risk there. Great for looking at babies, great for looking at blood vessels. You can see the flow of blood vessels. You can see some organs in the body. Not good for looking at bones or at lungs. Basically the way it works is sound waves are sent into your body, they bounce back off the organs and back to the transducer, creating the image. So it can't really bounce off air or bone too well, so it's not too good for that. But really good test for looking at some of the things. Also a great test when you do procedures. Sometimes I'll do some musculoskeletal procedures where I'll use the ultrasound, and I can put a needle into the body and kind of guide it with the ultrasound into a certain place. I can see the needle the whole time with the ultrasound, and then do things such as break up calcifications around a shoulder for calcific tendonitis, or inject into a joint or some soft tissues. And there's no radiation, so that's really good. So that's ultrasound and x-ray. Another test we do is the CAT scan or CT scan. That many of you may have had. You're kind of lying down on a table. They put you into a hole like a donut. Inside there, they're spinning x-rays. They go through your body really quickly. It takes a couple minutes, and an image comes out, high level of detail. You can see it all throughout your body, your brain down to your feet. The problem is there's a lot of radiation. Probably 100 times as much radiation in a CAT scan as in an x-ray. So that's a lot. You know, you think about 100 x-rays in your lifetime. Most people probably haven't had 100 x-rays, but one CT scan is equaling that just in one time. So we try to limit the amount of radiation you get with the CT scan. Now, when you're younger, like children, they're more prone to damage from radiation. So we really try to limit it. For children, we'll go ultrasound anytime we can as opposed to a CAT scan. In older patients, it doesn't matter quite as much, but we still try to limit it. So your doctors should probably try to order other tests before a CAT scan if possible. But it's such a good test that we still have to use it. If you fall and have to go into the emergency department, best test for seeing if there's any blood in your brain. Great test for looking at the lungs, broken bones. Really, the whole body can be scanned there with the CT. Now, MRI, that's really our best test. But unfortunately, it's also the longest test. Similar to a CAT scan, you're lying on a table, then you go into a donut. But this donut's a little bigger. There's no radiation. It's all a magnet, a giant magnet. And in there, they send some radio frequency pulses in, kind of change the spin of some hydrogen atoms in your body, and out pops an image. Great for looking at soft tissues, joints, spine, brain, blood vessels. Not so good for looking at the lungs and the bones. Takes a long time, but no radiation, so great test. But you gotta hold still, sometimes between 15 minutes and 30 minutes for that. So those are our basic imaging modalities there. You've probably had prescriptions for some of those things. Sometimes before you have the test done, we'll ask that you get an IV and get contrast injected into your veins. That helps us see the organs better. In case you're ever wondering if you get a prescription, why are they getting this contrast? That allows us to see a lot of things better. You might be asked to drink oral contrast before a CAT scan or an MRI. When you're like, why do I have to drink this terrible stuff? This tastes awful. Well, it really allows us to see the gastrointestinal tract better. So if you can stomach it, it's really worth it, and it has a lot of benefits.
PET scans.
PET scans? Good question. So in a PET scan, you get administered the radiation through an IV, and it's tagged to something that is taken up by cells that are very metabolically active. Cancer cells are very metabolically active because they're growing and dividing. So we inject that radiopharmaceutical in there, then you have to sit still for a while, because if you're moving around, you're gonna have metabolically active muscles. It's all gonna go in there. So you gotta stay still for about an hour, and then it's taken up by any cancer cells. So then when you go in and have the scan, that area lights up and we can see what's cancer. Hopefully there's none in there, but that differentiates cancer cells from other cells.
Not radiation also? There
is radiation, and in that test, it's actually, the radiation's actually being injected right into your body there, so you're radioactive for a little bit. You're actually giving the radiation out. So there's some other tests like that, nuclear medicine tests, where we actually do the injection, like gallbladder scans. A HIDA scan is an example. There's a few others, a bone scan, where you actually take up the radioactivity and are starting to emit it, and we have a camera around you that detects that emission.
And you urinate it out?
Yep. In the PET scan, it all gets washed out through your urine, so you want to drink a lot after that to kind of wash everything out. But still not a level of radiation that's really harmful. Definitely the benefit outweighs the risks in something like that. Another thing that administers radiation would become radioactive that actually I have some experience with is with thyroid cancer. The way we treat that is we tag radiation to an iodine pill that gets taken up by your thyroid gland, and then it destroys the thyroid gland. So you're actually radioactive for a while. I had thyroid cancer and had to take the radioactive pill, so for a week I wasn't allowed to be around anybody, which was kind of a vacation from my wife and kids for that week. So it was a week of bachelor time. But that's the exam where you probably get the most radiation. But that's for treatment, not for diagnosis. See, one other thing I want to talk about is mammography. That's a radiation test too, where they put your breast in compression there. We have new technology called tomosynthesis, where they take a whole bunch of x-rays through the breast. It creates a 3D image, much more accurate for detection of breast cancer. I highly recommend all the women get a mammogram every year. We've detected a lot of very small breast cancers that then have resulted in much better outcomes than waiting. Definitely don't wait on that. Try to get your mammogram every year and try to do the tomosynthesis if you can. That's pretty standard these days, but that's some new technology we have at Doylestown Health that I think has helped us a lot. Also, a little tip, before your mammograms, don't wear deodorant. The deodorant could cause an artifact and it looks like calcifications. So just kind of a common tip. Before your mammogram, no deodorant. We see that from time to time. So that's kind of a summary of the different things we do in radiology. Know that when you come in, we're back there. And feel free to ask us questions. Feel free to say, hey, I want to see the radiologist. I want to speak to him. We're happy to talk to people. And people forget we're even back there. It's nice to have some interaction, get out. So ask us questions beforehand, afterwards. We're always available and here for diagnosis and treatment. So we're just happy to take care of everybody in this community and know that we're out there, we're available to you.
You don't ask Google to do it for you, do you?
No. All right, any other questions?
Anybody have questions? I have one for you.
Yep.
So in your professional career, that as long as you've been here at Doylestown, is there a single technology or a single change that you've noticed that has really helped taking care of patients? You mentioned a lot of modalities already, but
yeah, I think
which one
I think on the broad sense, the tomosynthesis in mammography has had the greatest impact on the population in general, because half of the patient population should be getting a mammogram every year, or at least women over 40, so that's a good amount. And for almost everyone, we're doing the tomosynthesis. So that's increasing our accuracy for detection of breast cancer. So that's impacting the greatest number of patients, I would say. It's not necessarily the fanciest technology. In MRI, we've made some advances, but that is something, the tomosynthesis in mammography is something that just impacts pretty much everybody. Healthy or sick, you're getting a mammogram. So, yeah.
All right. Well, thank you very much. Thanks for coming by today.
Sure.